And hello and welcome back to the next episode of the Smileway Dental Facts. And today we have again Dr. Edwin here, alright, and me, Dr. John. What we're going to talk about today is that we are going to talk about one of the most important thing in dentistry is root canal treatment.
Yes.
Yeah.
Most of you has heard this term before, a root canal treatment, but some of you might not know exactly what it is. So today we're going to explain more in depth about root canal treatment and how it will help save your teeth. So for today, we will start by talking about why do you need a root canal treatment. So
yeah, because you see, root canal treatment, basically the reason why we do that, okay, is to actually basically depulp the nerve. Depulp the nerve meaning that we basically take out the nerve of the tooth, because your tooth contains nerve inside. So when we take out the tooth, we place some medication inside. Yes. This medication is going to do its magic, basically, right? It's going to kill or destroy whatever bacteria is in that tooth.
Yes.
All right?
So
yeah.
That's what Dr. John had gave you is just the short form of the root canal treatment, but I'm going to be more in depth about it. So for the root canal treatment, firstly, when there is an infection or swelling that you cannot describe, when you cannot explain, when it cannot be treated by antibiotics or any other measures, then there's the time to consider a root canal treatment. For the root canal treatment, usually there's a moderate to large amounts.
Yeah.
You take it out.
Yeah, no, it's okay, it's okay,
There's
it's okay.
Moderate to severe amount of pain in the tooth. So for this kind of tooth, we try to save the original tooth, because original tooth is always the best, and when it's replaced by artificial teeth, you will feel it feels a bit weird, something different, right? It takes time to get used to.
Because root canal treatment actually, that is the only way that we can try to save an infected tooth. Yes. You see, and sometimes, right, even there are people that come in with swelling, and then they come in, but the tooth is actually still strong.
Yes.
Right, still strong. It's still
sufficient tooth structure to hold a restoration. So first, we always take an X-ray to determine how serious is the damage of the teeth. So after determining the damage, we can always clean the teeth by removing all dirt surrounding the teeth to prevent any extra infection, any additional infection. So
then usually what we do is that after we cleaned it all out, we place the medication inside, isn't it? We place the medication inside, and we usually try to wait for a few days or even few weeks, right? So that the medication can do its magic, basically kill whatever bacteria inside.
Yes.
And after that, the second visit is basically flush it out, clean the medication, and we actually, if everything is okay, no signs and symptoms, and no pain, no swelling again, everything is fine, we actually close the canal with some materials, and we fill the tooth out.
Yes.
Right.
The materials that we use to fill out the teeth are biocompatible materials, and it has a consistency of rubber, and it is actually called gutta percha.
Yes.
So this filling is biocompatible, so it won't irritate your natural tissues. And also, by sealing off this gutta percha in the roots of the teeth, we help prevent any future reinfection of the teeth. So root canal treatment, in short, will prevent any future infection. However, if the root canal treatment is not done correctly, you might have a reinfection or subsequent swelling.
Yeah, like Dr. Edwin was saying, there could be reinfection happening, and as we know, like any other things we do in life, nothing lasts forever. We know that, right? Even when a root canal, we actually take out the nerve, we actually kill the tooth itself, but the tooth structure is really there. There is still a chance for reinfection. All right, it's what we call a secondary reinfection, but not to worry. In that case, you can always redo the root canal, try to get the infection out, and try to move on from there. There's a lot of people ask, Dr. Edwin, every time when you finish a root canal, is it necessary to do a crown?
Oh,
yeah.
So for a crown, we actually need to determine whether there is sufficient tooth structure to hold the restoration in place. If there is a very large destruction of the teeth, where there's no sufficient tooth structure to hold the restoration, that is when you will require a crown,
yes.
on that your RCT treated teeth.
Yeah, because sometimes, like for example, the front teeth, right? You might not even need a crown, right? But maybe the back one, because whenever you do it, it's such a big hole already, you might need something to cover that hole. And not to worry, because the dentist will know what to do. There are times where you need to put a pin, what I call a pin or a post, inside that tooth to actually hold the structure of the tooth stronger together before you can even put a crown on top. All right. But there is one drawback with root canal treatment. All right. Not everything in life is good, right? We all know that. So root canal treatment, actually, what it does is that if you do in the front teeth, sometimes it can give discoloration through time, like 5-6 years down the line. But not to worry, during the time they can do internal bleaching, basically put something inside the tooth itself to actually make the tooth whiter at the same time. All right. Yeah, you know, root canal actually it actually helps a lot of people save their tooth. You know, I have, you know, to tell the truth, I have patients that come inside and their tooth is like shaking. Okay, to tell the truth, the tooth is shaking. You know, magic do happen sometimes. All right. So we try to save the tooth. So we did a root canal. By right, it's supposed to be extracted. So we saved the tooth with root canal, and magically, that thing after the tooth itself after a year it became stronger. Yeah, and she's able to use it even till now. You see, so we never know what your body can work. You know, things can happen. You see, yeah. So that's what root canal can do. You know, to save the tooth.
Try to save your original tooth compared to extracting it and replacing it with an artificial teeth.
Yeah, but sometimes it doesn't really happen. You know, we have to take out the tooth itself. Then by all means we have to do that, and we have to replace the tooth itself, right?
Yes.
Yeah.
So don't worry, your dentist will always advise you on the best options to treat your teeth and to manage your condition.
All right. So if you guys have any questions, anything that you want to comment down there, of course, please do share it if you like it. All right, just comment below and we will get back to you. Isn't it, Dr. Edwin?
Yes.
Yeah.
So that's it for today. I hope you enjoyed this episode of Smileway Dental Facts, and always share and subscribe. Yeah, we'll see you in the next.
Yeah, see you guys. We'll see you guys in the next episode.